C, I believe that Dr. Christina Francis, who's the chair of the board of the American Association of Pro-Life Obstetrician and Gynecologists, is with us. And I believe that she may not be expecting to join me, but I'm hoping that she can. She is a medical bioethics and pro-life expert who's dedicated to human rights. She's tirelessly advocating for human rights of our most vulnerable children in the womb. And as I said, a leader in her profession of doctors of gynecology and obstetrics. So Dr. Francis, thank you so much for being with us.
Thank you, Craig. Thank you so much for having me. I just wanted to start out by telling you all a story of one of my OB-GYN colleagues. During her residency program, she was actually forced to undergo what they called values retraining because she refused to agree with the statement that abortion is good for women. And if the Equality Act is allowed to pass, we are going to hear more and more stories like this. The American Association of Pro-Life OB-GYNs exists to equip its members, thousands of medical professionals across the United States, like my colleague, with what they need to provide the best possible medical care to both of our patients, the woman and her preborn child. Like Craig said, my name is Dr. Christina Francis, and I'm the board chair of APLOG, as well as a practicing OB-GYN. 81% of Americans say that it's important for their medical provider to share their moral beliefs. Let us know in the comments if you agree with that statement. Even more importantly, as physicians who practice according to the Hippocratic Oath, APLOG members know that our duty is to do no harm. We will not hurt our patients, and we will not kill our patients. Sounds very reasonable, right? Unfortunately, politicians are trying to use the force of law to make us do just that. The so-called Equality Act would interfere in our sacred duty as OB-GYN physicians to offer the best possible and evidence-based care to our patients. It treats pregnancy as a disease, and it prevents medical professionals from applying our conscience to our care, declaring it discriminatory to not offer a procedure that ends the life of one of our patients and causes significant harms to the other. First, this legislation refers to medical conditions related to pregnancy and states that they should be treated as favorably as any other conditions. The bill says this requirement should be interpreted as broadly as possible, which would mean that abortion would be equated to any other medical treatment provided to a pregnant woman. Well, friends, pregnancy is not a disease, and intentionally ending the life of another person is not a legitimate medical therapy and should never be treated as such. Second, this legislation interferes with our ethical duty as medical professionals. Healthcare providers would be forced by law to endorse something that we know is harmful. Not only would this permanently damage the ethics of medicine, but as a patient, you would not know if your physician was truly recommending what was best for you or your child, or merely what they were being forced to say. Passage of this bill would mean that instead of utilizing our medical expertise and the overwhelming scientific evidence that life begins at fertilization and that abortion is harmful for women, we as physicians would be required to be a political voice in the exam room. Not only would this lead to a mass exodus of conscientious physicians from practice, but it will ultimately harm our patients. Is this really what we want for our country and for our children? Women's History Month starts on Monday. Our country has a rich legacy of strong and serious women who lead. Women have bandaged the wounded, taken seats on city buses, and pulled focus onto human rights abuses. Today, it's women here at APLOG standing for the mothers we serve and the children they carry. There are thousands of us, and we are fighting for our patients. Please let us and your legislators know if you want us to be able to continue to stand for you. Thank you, Craig.